one of the opportunities that I see with remote devices is having better data in the hands of clinicians to provide more comprehensive patient care and, help build better pre-visit summaries, et cetera. But it's not enough to simply present more data. Busy clinicians need the synthesis of the data, which is actually why here at Validic we launched generative AI summaries for remote patient monitoring recently to help really summarize quickly what's going on. But I often remind people that AI is a tool; it's not a solution in and of itself. And there have been numerous reports recently that have stated that generative AI actually slows clinicians down. I actually heard a funny story recently about how a system was exploring using generative AI to make a doctor's clinic note be more humanly readable because the physician shorthand was actually so robotic. So I thought that was a really interesting use. But you at Duke have been a leader for using AI in healthcare for years. I'm just thinking about what is the evolution ahead of us? Like, I wonder if you can share your thoughts and perspective about how you think about AI in healthcare. What are the real opportunities for AI to positively impact care today? What's not quite yet ready for prime time? What are we getting wrong? All that.
Yeah, there's a lot of qualitative questions there. Like I'll probably stay away from what are we getting wrong, but offer a couple of thoughts. We are first and foremost interested in and very focused on what we're considering responsible use of AI tools. Some of my colleagues at Duke are thought leaders in this space in establishing governance and establishing when to use tools and how to evaluate the models on which they're trained, not only the original training model, but also the continued use of such models. So folks from Duke and Mayo and some of the Hopkins and some of the other Stanford, other large academic medical centers across the country are really out front in some of these things. We, and speaking maybe for myself here, are taking an approach perhaps where we're looking for opportunities to apply these tools and learn from the application of these tools a ring or two away from the direct involvement in patient care. For instance, there was an article that was published last year, an health economics article that posited that there's somewhere between 250 and 350 billion billion dollars in savings per year by cleverly applying AI tools to back office functions. It's remarkable, things like supply chain, HR, policy management, technical support, transactional phone support, and things like this. We have done some things like applying an AI agent on top of our own policy manual